Throughout history, from the first cry of a newborn showing the delicate nature of human skin to the pandemics that left many wounds untreated, wounds have always been a part of humanity's challenging story. Today, the science of understanding, classifying, and managing wounds stands as a cornerstone of modern medicine, enabling healthcare professionals to provide precise and effective care. Welcome to the world of wound science and clinical wound assessment, wound classifications. What is a wound? A wound is any disruption of the body's tissues caused by accidents, surgery, burn, or disease. It can be as simple as a minor cut or as complex as a deep, non-healing ulcer. We classify wounds using two main frameworks. First, traditional classification, which focuses on visible characteristics and clinical practices. Second, advanced classification, which incorporates cutting-edge technologies like AI for enhanced precision. Let's start with the traditional methods, used extensively in clinical practice. These classifications are based on multiple factors. Location. Wounds can be internal wounds, affecting internal tissues, organs, or vessels due to trauma or surgery. External wounds, visible injuries on the surface, like cuts, burns, or punctures. Etiology. Cause. The cause of a wound plays a vital role in its classification. For example, traumatic wounds result from accidents such as cuts or crush injuries. Surgical wounds created intentionally during procedures. Burns caused by heat, chemicals, or electricity. Vascular wounds result from impaired blood flow, such as venous or arterial ulcers. Diabetic ulcers, caused by nerve damage or poor circulation in diabetes patients. Depth and severity. Wounds vary in depth. Superficial wounds only affect the epidermis. Partial thickness wounds extend into the dermis. Full thickness wounds penetrate through the dermis, exposing deeper structures. Healing progression time. Based on healing time, wounds are classified as acute wounds. Heal within 4 to 6 weeks. Chronic wounds persist beyond this time frame, often due to infections or underlying conditions. Contamination degree. Contamination and infection wounds are also classified by contamination levels. Clean wounds, no microbial contamination. Contaminated wounds contain microbes or foreign bodies. Infected wounds show redness, swelling, and pus. Healing process. The way wounds heal is another important classification factor. Primary intention. The edges of the wound are brought together and closed, usually with sutures, staples, or adhesive. Secondary intention. The wound is left open to heal naturally from the bottom up. This occurs when there is significant tissue loss or infection. Tertiary intention. Initially, the wound is left open to reduce the risk of infection or contamination. Once the wound is clean and stable, it is later closed surgically. Presentation or integrity of skin. Wounds are also categorized by whether the skin is intact. Open wounds. These involve broken skin, such as cuts, punctures, or abrasions. Closed wounds. The skin remains intact, but underlying tissues are damaged, as seen in bruises or hematomas. Morphological characteristics. Finally, wounds are categorized by their shape, size, and appearance. such as circular or oval wounds, irregular wounds with jagged edges, clean and neat incisions from surgeries. Although traditional wound classification methods are vital in the medical community, they face several challenges, including subjective assessments. Relying on visual checks and personal judgment can lead to errors and inconsistencies. Lack of standardization. Different criteria among practitioners can delay accurate diagnosis. Time-intensive. Manual evaluations take time, slowing down treatment. Limited analysis. Traditional methods cannot capture subtle wound details like depth or healing progress. Complex cases. Conditions like diabetic ulcers are hard to classify due to overlapping features. These challenges highlight the need for advanced approaches, like AI-powered wound classification, to enhance accuracy, speed, and patient care. The advanced classification of wounds represents a groundbreaking revolution powered by AI, capable of analyzing wounds with remarkable precision. By using deep learning and multimodal approaches, AI overcomes the limitations of traditional methods, delivering a faster, more accurate, and efficient classification system. Advantages of AI in wound classification. Enhanced accuracy. AI detects subtle wound features like texture, size, and depth with unmatched precision. Standardization eliminates inconsistencies caused by subjective human judgment. Faster diagnosis processes data in real time, enabling quicker treatment decisions. Comprehensive analysis combines visual data and wound context to deliver deeper insights into wound types. How AI works in advanced classification. AI-powered systems use cutting-edge techniques, including deep neural networks, to analyze wound images and extract key features. Segmentation algorithms, to isolate wound regions for detailed evaluation. Multi-modal mapping, to merge location and visual data for a holistic view. Pattern recognition, to classify complex wounds such as gunshot injuries or diabetic ulcers. This shift from traditional methods to advanced AI solutions is transforming wound care, improving both diagnosis and treatment. By embracing these tools, you can provide precise and compassionate care, leading to better outcomes for every patient. Don't forget to like, share, and subscribe.